Today we join hundreds of nurses around the country who are saying enough is enough. We need change in aged care and we need it now.
The aged care industry is in a staffing crisis. Over the last 13 years, chronic understaffing has seen a 400% increase in preventable deaths of elderly Australians in aged care.
Many more older Australians are dying prematurely from falls, choking and suicide. How many more heartbreaking scandals do we have to endure before our government will act to address this?
Last year, owners of aged care facilities racked up over $1 billion in profits, yet they are allowed to employ fewer and fewer nurses to care for an increasing number of vulnerable residents with increasingly complex clinical and medical care needs.
One nursing home that I visited had one RN there for about 40 patients she was looking after, and that is outrageous.
It's harder. People are coming into nursing homes now requiring a lot more care than they did when I first started, and the ratios, the staffing level is not providing for that.
Our elderly relatives who cared for us and loved us and contributed to society deserve better than this.
Our vulnerable elderly residents have been put at the mercy of what level of care companies will provide.
We need to make ratios in aged care law. Without mandatory minimum staffing levels in aged care, employers can simply not employ enough staff or cut nursing and care hours.
More staffing, more quality staffing, we'd be able to look after the residents a lot better, we'd have more time for them.
Ratios for aged care!
We've got to win a better deal for our aged care residents, for our members, so that they can do the care that they need to do. People working in aged care certainly don't do it for the money.
We need real action from this government to keep our residents safe. We need ratios mandated now. It is a matter of life and death. Will you join us to stand up for safe quality care